So, are you ready? All right, so now we're going to do catheter care. Actually, we're going to do two different ones. We're going to do emptying and draining the catheter bag, where we check and see how much is in the bag. So that's its own little thing at first. And we're also going to clean the catheter while we're here to do catheter care on the female. And we went ahead and got him up just to kind of show you the difference like we did. If you've seen the male and female peri-care, we're going to do the same thing there to save a little time and let you guys see what we're doing. So the first thing we do, we will need the drainage, alcohol to wipe the tip of the catheter bag off, a little bucket and soap for water, a chuck, towel, a couple wash rags, okay? And then of course we'll need gloves. So first thing we will do is we will come in, knock, knock, knock. Hello, my name is Jimmy. Are you Mrs. Smith? You are. Wonderful. Let's go ahead and get you ready. I will wash my hands and provide for privacy. So the first thing I'm going to do before I do anything else is grab a set of gloves, and I'm not going to raise the bed at this point. I'm actually going to drain the catheter bag and make sure it is good to go. So in order to do that, I will need a few things. I will need the chuck, this and this, and when you measure this, you will actually have to be within 25 mLs, if you can zoom in on this, 25 mLs from where your instructor will be, okay? You have to guess, or not guess, you will read what hers is, okay? So first thing we'll do is we will set our chuck underneath the catheter bag. We will set this here. And now this bag may look different than some other bags, okay? So first thing you want to do is, well, I unhooked it. But the first thing you want to do is pull this out like this, okay? And you will take this and you will open it up, okay? Open it up and it will drain in here, okay? So then when it drains, you will stop it. You will wipe it off with alcohol wipe. You will just open it up and wipe it off. Then stick it back. We will stick it back in here without touching it, okay? So then I'll remove this. Throw this one away, there's another one, and I will set it on the table over here so we can see what we've got. So now, here's what we have. Magic. Yeah, so now, I would measure this, you would measure this. It looks like it is 350 mLs. So you can be within 25 mLs of the instructor. So you and your instructor should have the same number, all right? So now that we've done that, and we've gotten rid of all of those things, rinsed it, got rid of it and everything else, we will come back to this. Okay? I'll go ahead and I'll take these off, throw this away in the garbage. Then I will tell her we're going to do her cath care. I will get my water, warm water in here, got a chuck, a couple things here. I'm going to raise this bed at this point. Raise the rails. I need one more thing which I did not get, and that would be a bath blanket, which is right there, and I will grab it in just a second. Oh, you're reaching it. Look at you. I'll raise this up. These videos are going to be awesome. So, we've got it raised up here. There we go, right here. Now my rails are up, so I'm going to come over. I'm going to take this one, lower this side down, cover her up. With a nice bath blanket. Pull this down right here. All the way down. And I would work like this, keeping her covered up. You guys can't see what I'm going to do, so let's open this up a little bit, get my gloves on, okay? So I've got gloves on now. Just a second. The first thing I want to do is make sure when I look, I want to look for any crusty drainage, all that good stuff. Make sure it is patent, it is flowing all the way through, okay? Make sure my catheter is in. If you ever come and the catheter is out, pulled out, you have to get a nurse. You can't put it back in yourself. Then I'm going to take this chuck pad and very gently, so I don't pull her catheter, I'm going to pull this over and put this underneath of her. This way I'm laying it long way so I don't have to move her very much, okay? Then I'm going to get my supplies here, put this over. I'm going to, I'll admit, get my water, my soap, and I'm going to kind of pull this out the best I can, kind of clean around the urethra area, right? I'm going to pinch this right here, okay? And I'm going to grab this catheter and I'm going to clean it about 4 or 5 inches down, okay? If you did not pinch it like I had, even though I'm right-handed, it's kind of awkward on this side for this. But if I did not pinch this and hold it, and I would pull that through and it would be very painful. So again, I will hold here, I will kind of rinse that area, hold this here, and I will wrap it around her, and I will clean it, rinse it off 4 to 5 inches down. I will pat dry. Remember, this is not Pericare, this is Cath Care. So we're only cleaning this area here, and then we are now just checking. Make sure everything is still hooked the same, make sure it's not pulled out, make sure the drain is patent and it's not hanging where it doesn't need to be, okay? So I will cover her over, pull her off to the side again, being careful not to pull that out. Get this over. And at this point, I will take my gloves off, but hold on really quick. Let me show you this. Come over here. Let's look at this guy. Now, this guy, the same thing. Let's look at him really quick. He's hooked up. Now we laid it on this side. Ignore this. Same thing. I think it's a little easier for the guy when you get this in. It doesn't want to come out, right? Because it's got the balloon that pulls it in. So you would clean around the end like this. You would pull the foreskin back. Again, if he's not circumcised, foreskin may be up. You have to pull the foreskin back. Clean around the urethra, okay? Just kind of clean around the urethra. Make sure you've got the catheter out as far as it'll go and kind of pinch at the end and then clean down. Hold on if I can grab it here. 4 to 5 inches all the way down. And then I would grab my other one here, my rinse one. And I would rinse around the end, hold it tight, and I would clean this way 4 to 5 inches down, okay? And just like over there, pat dry, put the foreskin back if he's not circumcised, okay? I just wanna make sure that you understood. And the same thing, you'll make sure it's patent, stuck, and it's all hooked where it needs to be, all right? Just wanna make sure you guys saw the difference between the male and the female on this one. So now that we've got, let's go back to this one. So now that we've pulled the chuck out and we've got it ready, we can go ahead and remove our gloves, okay? We will throw them away. We will pull this up here, just like this. Very easy. Pull this nice and pretty. Make sure it is all there. Raise this up. Get my supplies out of the way. Lower the bed down as far down as it will go. Okay. And we will lower this down. Lower this side down. Give her call light. Clean up my hands, wash my hands, clean up my mess, and report and record.